I am sure that you have seen the study that came out, the reporting of that study that came out just a few weeks ago, indicating that depending on where you get your news, even inside of the same news network, it could have a significant outcome on how you've weathered this pandemic that we're experiencing. It caused a lot of conversation online. It looks like some places might be getting sued as a result of it. And so I thought when I saw that study, I have got to talk to one of the individuals that put this together. And so we can now bring that to you live. We have PhD student from Harvard University, Akash Rao. Welcome to the Damage Report.
Thanks for having me.
Very glad to have you on. For people who might not have seen the reporting, and the vast majority won't have actually seen the actual study, can you give a bit of an explanation of what it was exactly that you were investigating?
Sure. So as economists, we've been interested in the question of how information and the media affects behavior for a long time. And so economists have looked at questions like how does information affect voting, violence and conflict, fertility decisions. And we think that pandemics are a particularly interesting setting to study the effects of misinformation because the consequences of my behavior actually spill over to other people. So if I don't think that COVID is a threat and I don't wash my hands, I don't wear a face mask, or I don't practice social distancing, I'm hurting not only myself, but those around me. And so any consequences of misinformation can really be magnified and have significant effects on behavior. And so that's why we studied misinformation broadly, and we zoomed in on Fox News for a couple of reasons. First, because Fox News is just by far the largest cable network in the U.S. It's around as big as CNN and MSNBC combined in terms of total viewership. So it's an important population to study. And then secondly, because viewers of Fox News are disproportionately elderly. So the median viewer age is around 65, which, if we know from CDC, is precisely the population that's most at risk from the coronavirus. And so potentially misinformation on Fox News could have more effects on behavior or be more dangerous than misinformation on other networks. And then finally, the impetus for Fox News was that there was really striking variation on the network and how the anchors covered the coronavirus. So in particular, the two most popular shows on Fox News, which actually are the two most popular shows, the news or news opinion shows in the US, these two shows told very different stories about how serious the coronavirus was. So Tucker Carlson really said that it might be a serious threat from as early as late January, and he discussed it throughout February. Whereas Sean Hannity kind of downplayed its severity. He discussed it a little bit in late January, but he essentially ignored it throughout most of February. And even when he began talking about it, he said it was no worse than the common flu, that it was a partisan hoax to undermine the administration, et cetera. And so from our perspective as researchers, that sets up a really interesting opportunity to compare two populations that are ex ante pretty similar, viewers of Tucker Carlson and viewers of Sean Hannity, and really zoom in on how the differing perspectives presented on these two shows might have influenced downstream health outcomes and behavior.
I want to jump in just for 1 second. So I'm curious in terms of, different demographic variables. So there is good evidence that shows that the, average age, the geographic distribution of Tucker viewers versus Hannity viewers is pretty similar.
So it's relatively similar, certainly more so than if you compare viewers of Fox News as a whole to viewers of CNN or MSNBC. There are still differences between Tucker Carlson's viewers and Hannity's viewers. And so we go through a variety of procedures in our paper to correct for those differences and ensure that they're not driving our results.
Okay, and I'm glad that you acknowledged that because I actually had to put out an article trying to explain to Sean Hannity once that his critique of a scientific study saying that it hadn't corrected for things. He didn't understand how that actually works. I'm glad that you do, especially with such important material. And so that sort of answers one of my follow-up questions was going to be why you'd compare two shows on Fox as opposed to like a Tucker Carlson and a Rachel Maddow or something like that. But I am also interested that you have two sort of non-straight news-related shows as opposed to having like a Chris Wallace and a Tucker Carlson, that you have two predominantly primetime opinion people.
Right.
And I'm assuming the audiences are far larger. So,
right.
I know that you did find that there was a difference, apparently, at county level in terms of number of cases and number of deaths of coronavirus. I'm curious, exactly what period did your analysis end at?
So in the version of the paper that's currently published, we're ending in early April. Since then, we've been able to extend our analysis, and so we're going to be releasing a new version of those results within the next week or two. That'll speak to effects until early May.
I mean, I gotta say, I can't wait to see that because I've been I've been curious. I liked that you differentiated Tucker Carlson and Sean Hannity, showed how they did take it differently, and they very much did. What I'm curious about is the late April and early May coverage, where I know that Fox News is now taking it seriously, like that's their stance. But predominantly, in the last week or so, I've seen Tucker Carlson do multiple shows saying that there's no scientific basis for quarantines. Laura Ingraham is obviously a slightly different person, but she says there's no scientific reason to believe that social distancing or wearing masks has any effect on the transmission of disease, which I found to be enlightening. Do you think that, I know that you probably don't want to spoil the paper ahead of time, do you think that you might start to see a little bit of a change in terms of Tucker Carlson's comparative advantage over Sean Hannity as you move into later April?
It's absolutely possible, because even as early as mid-March, we saw a convergence in how Hannity and Carlson covered the coronavirus. And so they really had strong differences throughout much of February. But, throughout the early period of March, throughout the first week or so, Hannity really started taking it more seriously. And that was kind of in lockstep with Trump discussing it as a more serious threat. And so in the version of our paper that we released, we actually found that the differences in health outcomes around 2 weeks later or 3 weeks later also started to converge. And so it would absolutely not be a surprise if we saw that those differences shrank towards zero, because these two anchors had become closer in how they covered the threat.
And, I alluded to in the intro that I had heard, I believe Sean Hannity made a sort of vague threat against one of the outlets that wrote up. They referenced your paper. It wasn't predominantly about your paper, but they did reference it, and he had made a threat to sue. I don't know that he's actually pursued anything like that. Have you or your co-authors received any sort of pushback for the results that you found?
So Fox News did put out a statement, essentially disputing our study, saying it was junk science, and pointing to instances where Hannity had covered the coronavirus, essentially accusing us of cherry-picking examples. And we don't think that's a fair criticism, essentially because we considered every single show that these two anchors had done. So we're not, looking specifically at shows where Hannity ignored the coronavirus. We're looking at every single show between late January and late March. And so there's really no scope for cherry picking in that part of the analysis.
Okay, yeah, you weren't just picking like a random sampling of segments. You were looking at the entirety of their broadcasts.
Exactly.
And I'm curious, I know that you're going to be releasing an updated version of this. Are there any plans to, for instance, see what effect maybe, this would be pretty difficult, I suppose, but long term in terms of how quickly people go back into the reopened economy, how long they stick to social distancing recommendations or mask guidelines, anything like that more medium term?
It's absolutely an interesting question. So we don't yet have specific plans to look at that. But certainly the question of how persistent are these effects? If I hear things repeatedly in February, do I still believe them in April, even in the face of information that contradicts it? Super interesting questions, and questions that I would absolutely be interested in knowing the answer to.
And I only say this mainly because I miss a little bit being in academia myself. Have you considered at all, I know that John Oliver did a show where he talked about sort of the timeline of the hydroxychloroquine narrative, how he traced it actually back to a broadcast on Tucker Carlson's show. And not long after that, Donald Trump began talking about it more often. Again, I don't know exactly how you would do this, but I would be curious to see, depending on how those hosts, how seriously they're taking it, if there's any sort of link a day or two later to Donald Trump's rhetoric about the pandemic. He has at various times seemed to take his cues from Fox and Friends and Sean Hannity and things like that. I don't know if that's possible, but just an idea.
Absolutely. No, it's super interesting. There's been some work in our field looking at how the media can actually impact political behavior. So, for example, a great paper for around a decade ago found that when the media isn't covering disaster relief efforts, the government spends less resources on those disaster relief efforts, presumably because they can't take credit. And so it's a super interesting question, this interplay of the media and political decisions. It's not one that we can really get at just given small sample sizes and given the situation, but it's absolutely very interesting.
Exactly. Yeah. And one president is about as small a sample size as you can imagine.
Exactly.
Well, anyway, I want to thank you for joining us on the show. It's fascinating work. Had a lot of fun talking with you, and I'll be looking to see the updated versions of this in the future.
Great. Thanks so much for having me.
Check out the Damage Report podcast each day, wherever you get your podcasts, whether Pocket Casts or Stitcher or iTunes. You can join me as I give you the news and stories you want, with a range of co-hosts and interview guests jumping in on the fun each day. Again, that's the Damage Report, wherever you get your podcasts. And if you get them at iTunes, don't forget to rate and review. Sometimes I'll read them live on the show.